myeloma is a cancer that forms in a type of white blood cell called a plasma cell. Healthy plasma cells help you fight infections by making antibodies that recognize and attack germs. People with multiple myeloma often require extensive and aggressive cancer treatment regimens, which can be both physically and emotionally taxing and come at high financial costs. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about how it's a burden to manage for caregivers as it affects the mental health. Caregivers for patients with multiple myeloma may suffer from higher rates of anxiety and depression than patients themselves. According to a new study published in Blood Advances, white medical professionals have long acknowledged the toll of a serious or terminal diagnosis can have on a person's mental health. Few studies have investigated how these conditions affect the family members, friends, and loved ones who care for these individuals. A total of 127 caregivers for patients recently diagnosed with and receiving treatment within the Dana-Farber Harvard Cancer Center network between June 2020 and January 2021. Researchers sorted participants into 3 cohorts based on the treatment regimen the patients they cared for were currently receiving. The caregivers completed questionnaires assessing their own quality of life and psychological distress, as well as their perceptions of their loved ones' cancer prognosis. Results highlighted that 44.1% of caregivers had symptoms of clinical anxiety, 15.8% had symptoms of depression, and 24.2% had symptoms of post-traumatic stress disorder or PTSD. In fact, when compared to patient symptoms as reported by the research team in a complementary study published in volume 128, issue 10 of Cancer, caregivers reported higher rates of clinical anxiety than patients with The study also uncovered a critical gap in communication between providers and caregivers. While most caregivers reported that their oncologist had informed them that their loved one's cancer was incurable, only 50.9% acknowledged that the patient's cancer was in fact terminal. Dr. O'Donnell voiced that wishful thinking, hope, and poor provider communications could all play a role in understanding this gap. Researchers concluded that one thing they hope that people take away from this study is that healthcare providers really do care about people's experiences as they go through diseases such as multiple myeloma, and that they're not alone in their suffering. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.